The death toll from COVID-19 has risen to at least 1,110 as of yesterday. In Hubei province, the epicenter of the outbreak, another 94 deaths and just over 1,600 new cases have been reported, the lowest daily level this month. And this brings the total confirmed cases in Hubei to just under 33,400 and the total cases in China to more than 44,000.
Let's have a closer look at those figures and talk to our Beijing correspondent, Olivia Siong, who once again joins us in the studio here in Singapore. I mean, there's been a lot said about when there's a possibility that this virus would actually sort of peak in number of, infected cases. Do the sort of prognostications sort of align with the numbers that we're actually seeing come out of China here?
Well, let's take a closer look at the set of numbers that have just been released from Hubei province. And what we zoom into to determine whether or not there's been a peak is the number of new cases. And that's what experts are looking at. So as of yesterday, the figures that are being reported, number of new cases in Hubei is 1,638. And that's the lowest number that we've seen this month, actually. And we also look at the numbers outside of Hubei province. We're still waiting for the statistics as of yesterday for the whole country. But as of Monday's figures, we saw the number of new cases reported was 381. And that was the 7th straight day of decline. And so experts are saying that these positive signs, but probably it's still a bit early on. We heard from China's leading epidemiologist, Zhong Nanshan, who has really been fronting a lot of this coronavirus outbreak. And he also played a key role in managing the SARS outbreak. And he said that he thinks that the peak could be reached in mid-February or at the end of the month. And that's when the number of cases he expects to plateau and then decrease. And this is based on a mathematical model, also based on the actions that the Chinese government is taking and also the climate as well. He says that he does hope that the outbreak in China could come to an end in April. But of course, there's still a lot of fluidity on the ground. We also have to know that, the issue really is still in Hubei. And if we were to look at the numbers again, there were 94 deaths reported, and the death rate now stands at about 3% within Hubei. But if we were to look outside of Hubei, that death rate is much lower. The last I looked, it was about 0.2%. The big question is why? Experts say that there could be two reasons for that. One is that there's something different about population, but that is unlikely to be the case. So it points to a second reason, which is more of, we do know that the medical facilities and resources in Hubei, and especially in Wuhan, which is where the virus outbreak was believed to have been originated from, is extremely stretched. So patients may not be getting the appropriate care to recover from this. And so, whether or not there'll be a peak, as Mr. Zhong Nanshan says, remains to be seen. He had made an earlier prediction of an earlier peak sometime back, but that was not the case.
At least it's a good sign that the number of new cases is not increasing, but actually decreasing over some days, right? I mean, it's a step in the right direction.
It certainly is. And of course, WHO has given the virus a new name, COVID-19. Right. And it seems like it's gone extraordinary lengths to sort of dissociate itself from Wuhan, which was the epicenter of the virus. There was no mention of any animals or a group of people. Could you talk to us about what went behind the decision of the WHO?
Yeah, the WHO has taken quite some time to name this new virus, and COVID-19 does stand for Coronavirus Disease of 2019, which is, as you mentioned, an extremely neutral name. And as you said, doesn't reference a geographic location or specific animal. And the WHO chief said that this is so that it prevents other names from that can be used for stigmatization. As we've seen, since the outbreak, we've seen travel restrictions being imposed on travel to and from China, as well as countries closing their borders. And we've also seen many reports of discrimination towards, within China, people from Hubei province and outside of China towards Chinese or people perceived to be Chinese as well. We've heard reports of shops being, rejecting Chinese tourists. And recently we heard a DJ had to apologize for, a China virus song that was seen as discriminatory. And so this has all been the fallout from the virus. And so I think the WHO is very cognizant of that when naming the virus. And the Chinese media has also accused some media organizations of using language and visuals that fan this sort of sentiment, and said that no matter the origin of the outbreak or whether the fault lies in a few people, that this not everyone should be tarred with this by the same brush. And let's have a listen to what WHO had to say.
Okay.
We had to find a name that did not refer to a geographical location, an animal, an individual or group of people, and which is also pronounceable and related to the disease. It also gives us a standard format to use for any future coronavirus outbreaks.
Yeah, so the WHO, besides naming the new virus, also did say that, time is of the essence. And yesterday, we have to remember, we saw the highest number of deaths recorded. And it did say that the world must, quote, wake up and consider this enemy, the virus, as public enemy number one. Those are really strong words. And so then they are saying that there's a limited opportunity to contain the spread of this virus, and really instead of looking at and it could bring economic, social, political upheaval. And so really, I guess what they're trying to do is, global cooperation really needs to come together
because
to address
it's an
this.
international problem right
Absolutely.
now. And I mean, them sort of neutralizing the name of the coronavirus, the COVID-19, and neutralizing that is probably a smart move.